Welcome back to the Health Tech Edge podcast. I'm Mike Moore, and today we're doing a late mid-year check-in on AI in healthcare. A lot has happened in the first half of the year, from new pilots to measurable results. Joining me is Raheel Retiwalla, Chief Strategy Officer at Productive Edge. Raheel's been working closely with healthcare leaders across the country and has built more than 50 AI accelerators, practical, ready-to-use solutions that show exactly how specific workflows can be improved. Leaders love them because they get to see their potential future when AI reshapes their daily work. And since this is a video episode, Raheel will even show a few of the accelerators on screen so you can see what we mean in action. Raheel, great to have you back.
Hey, Mike. Good to check in again.
All right. So yeah, we've been trying to do this as a mid-year
Oh,
check-in, and just the summer was busy, which is good. But we're a little late. But I think this will give healthcare leaders a understanding of kind of where the market is at, what we're seeing with healthcare leading organizations, and then also kind of where we can go from here. So that's I think an exciting opportunity. So let's start with that. What's the mood? If you talk about some of the conversations you're having with healthcare leaders, what's the mood out there right now as it relates to AI, and maybe kind of thinking about that both from the payer and the provider lens, since I know you speak with both types of organizations.
yeah, I would say that, of course, it wouldn't be a surprise if I said just everybody is seeing, hearing, evaluating, discussing something relating AI. And in general, it's a great momentum for a wide variety of reasons. But I think if you kind of strip the excitement and innovation speed back and kind of look at what's driving actual implementations and actual use, it comes down to a few core things. Like one is, do we understand the operational workflow and how we like to think about it as a rewiring of that workflow? What is that going to look like from a end-to-end workflow perspective? Are we focused on the entire workflow? Are we focused on a specific task in the workflow? And based on that, what is the business impact and therefore the ROI that this particular solution might give us? That's a conversation and understanding that is front and center. The second one is just sifting through a lot of point solutions that are, in many ways, a good thing, solving very specific problems. And there's a lot of innovation happening right now, targeted at these specific things. But that poses a challenge for leaders, which is they're seeing a new solution every single day, and just become unsure of where things are headed, what the innovation pipeline would look like, what betting on one thing versus the other means. So that's something that is happening. The third, I would say, is just a broader focus on, and a deeper focus on, responsible AI. So it's the more point solutions that you consider, the more the responsibility is there for you to understand what the AI is doing, make sure that everything that you're implementing and investing in is auditable, is observable, and has a way for you to be able to understand and be able to react to various situations. So how do you do that when your strategy might be to invest in multiple point solutions, which individually are maybe significant impact on certain tasks or workflows, but add to the enterprise need for more deeper level of governance. So that's a conversation. And then largely are connected to all of that is a broader AI strategy. It's like, okay, so there's a lot happening, and individual operational leaders, whether in provider side or on payer side, are evaluating ways to improve their operations. IT is essentially involved in that conversation, but then has to step back and kind of look at the landscape and say, what does a unified AI strategy look like? How does that feed into our, especially if you don't really have a full-blown implemented, modernized data environment? What does that strategy look like today versus when we start to get there? So trying to play that roadmap out and make sure that there's a method to make to that madness is something that's on top of, I think, IT organizations' minds. So I would say those are the real key areas, Mike, that are emerging in conversations, as at least ones that we've been involved in.
Yeah, and I think that's good to consider, right? It's that everything is AI, right? Every application, every vendor, everybody's got AI. But I know one thing that you talk about with customers is, AI isn't just one thing, right? Obviously, it's there's different functions it can perform. There's AI agents. There's a lot of talk around this. You've got kind of a simple model that you talk about in terms of, I think it's the 4 key functions that you see AI playing. Do you want to share that with the audience and kind of talk about that simple
Yeah,
framework?
I think it's a way to kind of just put things in context as to where AI can assist today, where can it help us next. And it's not necessarily a maturity model, though you can view it as one. I think the most low-hanging fruit opportunities, both across payers and providers, is to have AI assist in summarization and aggregation of information. So there's, regardless of how you look at different operations across both types of healthcare organizations, and you drill into each workflows, you'll realize that there's a significant amount of time staff spend just organizing information before they can act on it, and trying to figure it out, trying to understand what information is telling them. For me, that's a great use case for AI. Whether it's as menial as, I don't understand this process, so what should I, what do I need to do? What do the rules say? What do the regulations say? What can I do? What cannot I do? Just even those kinds of questions that are not even necessarily involve PII or PHI initially, right? So you can assist people there. There's just a significant amount of time savings just from doing that. And then once you have those kinds of use cases thought through, the natural next step would be, well, AI helped me understand this information. Now, can it actually recommend something based on that information, based on the context and the situation and the task at hand? And so that's the second one, which is recommend. And the third is, well, AI can recommend, but can essentially, nudge me or perform some kind of activation, in the moments that matter, so that we're not lagging behind those opportunities. And then lastly is, if I can do all that, can it help me just execute some things that I would have done, but it can, just are menial enough that I can just go do, or it can just go do. So those are the 4 things that we look at as a way of saying, how can we build a roadmap for use cases around AI, or investment portfolio of innovation that can assist in those 4 areas. Some you start with summarization, aggregation, evolve them into recommendation, evolve them into nudging and activation. Some, you may have to go directly to recommendation. The use cases may dictate that. But I think if you are looking to start somewhere, just identifying in those 4 contexts, given a workflow and given sort of tasks within those workflows, it can start helping you get sort of a framework in mind that can be used.
Yeah, I like that, because I think it's almost like, you can think of it in somewhat of like a toolbox metaphor, right? Like, I've got these 4 tools in my toolbox. We've got these kind of problems across the organization. We can look at what the problem is that we're trying to solve and which is the right tool to apply for it. And that can be the role that AI takes to make it kind of come together. So I know that you've been working on a set of accelerators. That's something you've been quite busy with. And I'm going to invite you to share your screen here in the video version of this podcast. We'll obviously, for the audio folks, try to describe it as well. But we can maybe share the use cases and those accelerators on screen
Sure.
if you want, and walk through a couple of them just to give some examples to folks of what people are seeing and how to apply those 4 the 4 different tools that we talked about.
Yeah, absolutely. Happy to. So you should be able to see my screen.
All right, let's pull you up on the screen here. So, all right, so what are we looking at?
So what you're looking at is a set of accelerators, as you described, that we've been focused on really identifying specific workflows. First of all, specific operational areas where we believe, based on our 18 years of experience in healthcare and just working with, across the healthcare ecosystem, not just in the US, worldwide as well, and identifying those workflows where there is opportunity to apply those four capabilities from an AI perspective. And for payers, we've kind of identified these 8 core operational areas. The one thing I want to make sure we don't try and say is that I don't like to kind of view opportunities as singularly focused within an operation, because the bigger promise of AI is to see how we can actually cross workflows and drive even better efficiencies. But I think that's for sort of the mid to longer term. The near term opportunity, of course, is to kind of think about these individual operations and see where we can drive efficiencies or level of engagement or clarity or speed to decision or speed of being able to engage an action today, right, in the near term. So that's the mindset here, and not to necessarily kind of think of it as silos, right? That's not what we're trying to do. Population health and clinical operations, I would say, is the biggest area of opportunity. We think, whether it's from a perspective of utilization management, care management, and things like service plan creation, things like just care coordination, a lot of complex manual opportunities to kind of not be as efficient. That's where we can apply that. I'll give you a couple of examples. Duals integration, organizations that actually have a duals contracts. How do you actually provide clarity to members and yourselves on the rules that are Medicare and Medicaid for a given transaction? So there's confusion there, and then there's a lot of energy that goes through there. There's, of course, regulatory resilience, right? So there's a lot of regulatory compliance needs coming up, not just from an AI perspective, but even generally. So how do you make sure that you're staying one step ahead of that? Of course, prioritization and I think there's plenty of solutions right now in that space, but we've identified even more detailed tasks where we can certainly apply AI, even from a perspective of just task-oriented efficiencies. There's value-based payment and quality, of course, from a payer perspective, where there's contracts you manage with so many providers, and how do you kind of ensure that you're getting the most out of those contracts? Of course, claims and payment integrity, big area. Member and provider experience. Even though a lot of you may see here is kind of back office focused, and largely because there's just so much there from a efficiency gains perspective. There, of course, is member and provider engagement as a front office facing sort of experience need. And the reality is there's so much innovation happening there as well, that from a productive edge perspective, we felt, let's not go too deep into that. So you'll see there's only 3 use cases there, largely because a lot of point solutions are enabling some of this. And then lastly, something that you don't really think of is actuarial intelligence. We believe actuaries are the lifeblood of a payer organization, and really the work they do is so critical, but sometimes lags. Imagine giving access to actuaries information at their fingertips, even if it was done 3 years ago, and more importantly, giving things like early warning systems for them, but not just to them, but also to the rest of the organization. So it's these kinds of things that we think about and we work on, and these accelerators have been designed, and the use cases and the visual experiences are built to help people see that. I'll just show maybe perhaps one of them to you. A simple one I'll show you is something called a pre-visit face sheet generation. And what you'll see in our use cases and the visual prototypes that we've created, we kind of talk about who the persona is, what the context of the task is at hand, because the AI has to understand the persona really well, understand the task at hand, how it fits into the broader workflow, what is it that we're really trying to get to, and how is this going to enable the outcome, whatever the business outcome that we're looking to gain out of it. But then also, AI actually can have multiple forms. So it can come in the form of assistance in a chatbot or a co-pilot. It can come in as a background process. It can come in form of an email alert. It can be a ribbon that assists people with existing applications that are complex. So there's many forms that, it's ubiquitous in many sense and omnipresent in that sense. So we talk and think about like how does a particular AI in that particular workflow for that particular context and persona and that task, what is the form it will take? And what is it doing? Is it summarizing? Is it recommending? So you kind of connect those dots and you kind of get a real great way of kind of thinking about the use case. In this particular case, the use case is care managers who are getting on a phone or either on a phone call as a monthly check-in or yearly check-in, or physically visiting for needs assessments that are required by state regulations. But each visit and call requires some prep time. And a lot of this information that they need is to do with, and I'll give you a quick example of that, has to do with just getting a current sense of the situation with the member and being able to identify certain key needs that can bubble up so I can be much better prepared. And today it's just difficult to get that picture for a care manager. So what we've done is we imagined a use case and an accelerator designed for that essentially is focused on here's your priority actions for today, from a medication adherence perspective, from a missing care gaps perspective, from social determinants of health perspective, and demystifying the recent care timeline. From a payer perspective, it's always very difficult to untangle exactly what the clinical touch points have been over the last certain period of time. Was it a PCP visit? What exactly happened there? Did that lead to a particular, a prescription, or did it lead to a certain specialty specialist doctor? It's just that the timeline is very difficult to produce in a way that's easy to understand. So we want to focus on that. We want to untangle and demystify that. And we want to focus on medication status, so it's clear what's going on. Are they adherent or not? What are the care gaps and needs that we see? What are the contexts and barriers that you should be aware of? And be able to kind of just capture this in a way that is actionable for the person, for the care manager. So they're not spending 60 minutes, 45 minutes trying to prepare this information. They're spending that 45 minutes just to focus more on the things that need to be focused on. So that's just one example, Mike. But
yeah, and I think that's a great one because I think we've talked in recent episodes with some of our other guests about helping clinicians operate at the top of their license, right? So, this may be a care manager for a healthcare payer who's an unlicensed professional, but still a professional, right? Or it could be a nurse practitioner, a doctor, a physician's assistant, someone who has a medical license. And we think about those sort of people that we obviously want to help them operate at the top of their license versus being mired in kind of the administrative work. So what you showed in that face sheet example, I think, is really interesting because without the AI assisted summarization that you just showed on the screen, they would have to go to a variety of systems and tools and try to pull that information together, synthesize it either in their mind, on their notepad, or maybe on screen in a set of notes that they would collect. The other thing I think about that workflow is that so much of what payers see about a health plan member comes from claims, right? So it could be claims submitted by the doctor, specialist, pharmacy, wherever that stuff's coming through. Synthesizing that into a human view of who is this person, what is their life like, what are the things that they're dealing with, pulling in social determinants of health and some of those other data elements and really trying to tell the story. So again, that clinician or the care manager can think about this person and kind of how we help them be successful really is I think a great opportunity. And that's, I know, just one of many examples. So do you want to talk about that? So this has been payer focused, right? And kind of the site that you've walked us through. Do you want to show us on kind of the provider side some of the things that you're thinking about and have put together?
Absolutely. But before I talk about I'll show you something about providers. I think it's important to understand the provider landscape right now, right? So I think from a provider perspective, the challenges obviously are very different. But the way the providers are going about, adopting AI is a little different from the payer side. for a couple of reasons. I think there is a lot more innovation around AI specific on point solutions in the provider space. There's, of course, the EHR, which is central sort of innovation hub, depending on your vendor and how fast they're innovating. And then what else can you add and, sort of surround that EHR with to really drive further efficiency gains. And some of the things we think about are essentially that many I know for a fact are thinking about or are already doing something about things like coding accuracy or just better charge capture capability, detecting missing or misaligned documentations in real time, just optimizing DRG and reimbursement, for example, preventing denial claims, and identifying those risks before submissions, looking at contracts and underperformance of contracts on the provider side, of course, as well, by constantly monitoring payer terms and value-based incentives, compliance on pricing transparency and things like documentation standards and audit readiness. There are a lot of solutions that are kind of coming up for that, and it's a very interesting space because as providers, you're kind of trying to figure out where's the momentum for my EHR vendor kind of heading, right? And then there's, of course, a system that's the primary systems of record, and also becoming more and more a system of engagement. There's, depending on the EHR, they're adding CRM capabilities, for example, or if you're a larger health system, you've kind of already invested in a deeper, CRM investment and patient feedback investment and contact center investments. So how all that plays together, and how do you kind of think about those point solutions? So the blanket statement for me, at least on the provider side, is there's a lot of kind of connecting the dots and kind of thinking through the near midterm to long term where things are headed, and then kind of using that as a way to decide what is my near-term strategy going to be. But said that, for us, and I'll just switch to the provider side of things, we've looking at the landscape of innovation in the provider space or AI, whether it's scheduling, nurse scheduling, whether it's shift insights, whether it's patient flow, whether it's contact center efficiency, like there's a lot happening there, right? So one of the areas that we feel there is still, there's still things that AI can assist in, and we're calling it really financial resilience, enabling like sort of that level of financial resilience. And for us, it's things like revenue integrity optimization or contract performance intelligence, like automating risk and compliance, and then some level of workflow efficiency. So whether it's looking at, things like capturing charges better, or preventing denials and, having a recovery capability faster than you are able to do today. And I'll just show again one as an example, and this is, kind of showing a view of, what it would look like in an EHR. Right, so I have a EHR, I'm essentially documenting, simulating the documentation. And the thing about this is as a documentation is being either through a scribe or through a ambient scribe or through a actual voice scribe that is initiated or somebody actually types that in, you're able to actually determine some very specific charges that emerge from that. Now there are coding solutions that are doing this, and you can kind of carry that forward and say, am I making sure that all my, charges from that codes and et cetera are correctly identified? And, and you can imagine a system like this that spends that saves significant amount of time for someone to do after the fact. You're actually able to, surface these things really in real time or near real time. So that's an example of that. It just is a bigger, it's part of a bigger strategy around financial resilience. And that's something that we work with our provider clients on.
Yeah, and I think to your point, in the ecosystem, there are so many solutions out there on the clinical side of things, clinical workflows and those kind of, tools for doctors and nurses and all the licensed professionals out there, focusing on kind of the revenue operations, revenue cycle, right, is so important, and there's so much help that's needed there, and making sure that the health systems get paid for the work that they're doing, right, and that's kind of, I know, a constant struggle with the battle of the AI tools. I talked to a guest a few weeks ago. We were talking about, just like prior auth, right? Like clinicians are deploying prior auth on their side to better submit
Yeah.
those requests. The payer side submitting, better on their side with AI tools to kind of, work that process. So it's like it's the war of AIs, going into some of these different
Yeah.
workflows. But I think overall, the more we can automate, the more we reduce the human steps that are needed to improve the results and reduce the cost for everyone. Just brings efficiency. So many opportunities here. When you're working with health leaders on either payer or provider side, and they're saying like, we've been talking about this. We want to put some action into our plans for the rest of 2025 and into 2026. How are you advising them on kind of how to move forward and kind of take those steps?
Our approach really is to focus on identifying and building that use case roadmap. I think that's where the rubber meets the road. And essentially, you're engaging, operations teams. You're looking at cross-organization opportunities. You're bringing teams together because none of these workflows are so individual, by the way, that everything just works in a silo. So you bring cross-function teams together, and then you essentially identify where those low-hanging fruit opportunities, use cases are in the near term. You get, you identify what the ROI and the business impact is. You get that validated if you're in payer side with, you're from an actuarial perspective and your financial team's perspective, like what, do we actually believe, things like, the ROI that we're thinking about, how it's going to feed into your financial models. So you have to really do that work. You can't just say, I'm going to save 20 minutes here. But when it comes to things like even the face sheet generation, for example, what's the real impact of that face sheet? But if I'm able to predict and provide needs that weren't clear before, how does that improve? For the clinical side of things and opportunities there, not just the efficiency on the from a staff perspective, right? So how do you really understand that and then use that to drive a prioritization of the roadmap? Then there's, of course, on the technology side, perhaps limitations or challenges in terms of what I can do today versus what I can do, based on some other transformation work that may be happening in the organization. So kind of figuring that part out and making sure that you look at not just business impact, but also feasibility as the other major sort of vector. And then you use that quadrant-based concept to say, okay, what's in the highly feasible right now and what is highly impactful? And then you kind of build a roadmap starting from there. So that's one of the things we're doing with a lot of our clients. And then you think about pilot. How do you ensure you get a pilot use case out fast? And when I say fast, it's typically 8 weeks, 10 weeks type time frame. The technology is depending on, of course, on the feasibility part, right? Are we able to do that, right? But assuming you have the technology landscape enough that we can actually build something, typically it's in the 8 to 10 week range, and you work very closely with the pilot team. You work very closely to get feedback. You work very closely to educate them on what's just the change management side of things, and then you iterate and you kind of build on top of that. So that's the method we've used, the traditional sort of user-centric, customer-centric approach, and that pays off. Viewing things like that, and you build responsible AI as guardrails to begin with. You don't think of it as an afterthought. You just do it primarily. So another thing you do with use cases, by the way, is not just business impact feasibility, but also risk and compliance, right? So, and governance. So you say, okay, what is the risk profile of this use case? Is it handling PII, PHI? Is it going to be, just reading data or entering data, as well? Like, there's a list of those risk profiles, and you say, okay, this is a lower risk use case, and therefore the guardrails need to be like this, and the organization is enabled to apply those guardrails. So you kind of take a look at those factors, and then you say, okay, let's focus on the pilot and take the customer-centric approach to that. And you focus on making sure you're able to measure the success as well. So you're not just leaving it to not knowing how best to monitor and measure, but you want to make sure you bake in the ability to measure the value so you can demonstrate it effectively as well.
Yeah, and I think that's great advice. And I think that I'm glad when you said, the quick wins, you put a time frame to it, because I think that helps people conceptualize this, right? Like, how should you be thinking about it? That, no one wants to wait for a 10-month or a 1 year or a 2-year project to deliver this, right? Because it's happening now. And, there are various statistics out there about the percentage of, for example, physicians who are using AI tools today, right? So it's kind of like the iPhone that's in everybody's pocket. Like, everybody's using advanced technology and tools in so many ways already. Let's bring it into the workplace. And maybe this is that opportunity to leapfrog a generation of technology and help healthcare, catch up. So Raheel, thanks for joining me today. This has been a great discussion and kind of getting your take on what's happening and some of the real world discussions that are happening with leaders, and taking a look at those accelerators and how those can be helpful visualizations. So thanks for giving me time
Anytime, Mike.
today.
Happy to be here.
Yeah, so for anyone who wants to learn more about this, certainly you can reach out to Raheel through LinkedIn, or visit him at productiveedge.com. With that, we'll go ahead and wrap up this week's episode of the Health Tech Edge. If you liked today's episode, please like, comment, and share with a colleague, and we will see you back next time for another episode of the Health Tech Edge.